Exactly 15 minutes to the top of the hour. You're still on Good Morning Kenya, still Viewpoint. We'd dissect a bit and talk about physiotherapy, and this is in relation to commemorating this particular day that annually happens on the 8th of September since it was designated in 1996, just to create awareness as well as celebrate those in this particular practice. I'm holding court with my guest, that is Henry Opondo, who is the president at the Kenya Society of Physiotherapists. Karibu sana.
Thank you,
Doreen. I almost changed your name. But good morning to you.
Morning.
All right, and I just want us to broach this discussion from understanding and putting context to what you want to discuss further, and that is understanding what physiotherapy is.
Thank you, Doreen, for this opportunity. And as you say, my name is Henry Opondo, not Odongo.
Yes.
In regards to what is physiotherapy, number one, physiotherapy is a medical profession. That is, should come out very clearly.
Yes.
So, it being a medical profession.
Emphasis on the medical.
Medical profession. Yes. So, a medical profession meaning its primary function or its core function is to offer clinical interventions or clinical services that will restore, that will promote, that will maintain and actually optimize a patient's mobility, function, and overall well-being.
Okay. So this is actually a medical profession, not as how it has been termed over time, because I was just looking at an article which stated that in the past it was normally regarded as massage tricks here and there, but it is actually a medical profession.
And we'll get to talk about that. And from that simple definition of what physiotherapy is, besides being a medical profession, when we say offering clinical interventions that will restore, will promote, and optimize patients' mobility, for you to actually understand that Doreen's mobility or movement is not in order, you need some science. You need to understand how the joints operate. You need to understand how the muscles operate. For you now to say, I want to bring it back to normal, you should be able to assess and diagnose and say objectively that, you know what, Doreen, this structure is at fault. The structure could be a muscle, the structure could be a tendon, it could be a ligament, and to say now it is at the optimal, this is the best that you can get. Again, that requires critical thinking, that requires science, that requires understanding of the human function. So to say it's massage, you can really tell that massage, I mean, even you, when your kid falls down or they hit their head, you massage their head. That is not physiotherapy.
So it's beyond what it has
it's
been
beyond
termed.
the perception.
Oh, yeah.
Yes.
And that's what we are here to do, actually, to demystify the perception, because even as you're talking earlier, we were saying that oftentimes it's not regarded with the high esteem that it needs to, because of, you know, those assumption and perception there. But we'll get to that momentarily. But yes, even as you talk about it being commemorated tomorrow, that's happening tomorrow on the 8th of September. This has been the trend since 1996. I mean, except just creating awareness, why is it also equally important to have this day or commemorate it, so to speak?
Yeah, great. Thank you so much. So this day again is not actually set by Kenyans. Neither is it set by Ugandans. It is set by the world governing body, which is called World Physiotherapy. So World Physiotherapy provide overall guidance in terms of physiotherapy practice in different countries. Just like we have World Health Organization that works with the different countries through the Ministry of Health to cascade down policies that are help to improve the public health. So in physiotherapy, not to equate, but to just bring that understanding that we are aligned by the World Physiotherapy Body, whose headquarters or offices are in the UK. They are the ones that brought this concept of 8th September to be the World Physiotherapy Day. And every year, we have a different theme. This year's theme is different with the last year's theme, and so surely it will be different with the next year's theme. Why 8th September? Again, it is because that is the time that the World Physiotherapy Body was formed, on an 8th September, I think 1956.
Is it 51 or 56?
51. You will know physiotherapy more than me. Okay? So this day what we are doing is that we are coming together as physiotherapists, not only to enlighten the public, not only to demystify the perceptions that have been misconstrued about physiotherapy, but also to recognize some of the milestones we've made and appreciate what we have not done right to help improve the public health as well as improve the welfare of our own physiotherapists, the service provider, and also bring other stakeholders, because we cannot work in silos. Bring other stakeholders that plays a great important role to truly understand the contribution of physiotherapy in the management of public health. These stakeholders could be people like National Hospital Insurance, the NHIF, Ministry of Health, and many others. So this is what we intend to do on 8th September, which is tomorrow.
All right, and we'll get to that event, which actually you've partnered with KMTC and KNH in a bit. But you've said something that I want us to get deeper into, that celebrating this day or commemorating it is not just for the sake of awareness, because when you look at most of these days that are normally celebrated annually, talk about World Forest Day, World Water Day, Cancer Awareness Day. Oftentimes there's that idea, I know there are other reasons behind them, but there's always that inclination to create awareness. But you say that it's also not just that, but also allied to understanding the milestones we have made so far, the loopholes that still exist therein. But also, why is it just important for that awareness bit before we get further to the details of having this day?
The awareness bit, again, is because no one was born with all the knowledge.
True.
And if you look at medical industry, sometimes it's a very sad industry, because the people who comes to you, they are not happy. They're in pain. They need solution. And currently, our health setup has had a lot of bureaucracy. And it's a one-sided market. It's not like you walk to the supermarket and choose that, you know what, I want to buy a cooking oil and I'll settle for Chipsy. But when you come to the kind of healthcare that we have currently, you are a recipient of what the doctor says or what the physiotherapist says. The best you can do to Google, but no one will tell you that what you Google is right or correct. So patients or the...
Because you're also subject to the information that you found there.
Exactly. Okay. So the public is not so much aware of certain cadres that they can actually access directly without a lot of bureaucracy, that I need to go and see so-and-so, 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 to later refer me back to physiotherapy. And sometimes we get to refer them for physiotherapy when it is too late. So that's why we also want to bring this awareness to the public that physiotherapy has a role in these kind of conditions, and we're inviting them for like screening so that they're able to understand. I don't need to go and queue, wait for example an orthopedic surgeon, not out of bad faith, wait for an orthopedic surgeon when it is something that truly I can easily walk into one facility, let's say in Bagadi sub-county hospital, see a physiotherapist, get sorted out, and go back home.
I think that's why it was important for us to understand what exactly physiotherapy is. And just as you rightly put it, it's actually a medical profession at the end of the day. Let's go to those milestones. 26 years later, and again, as you said, it's not a day celebrated by Kenyans or Ugandans in the examples you gave, but this is a world day. It's an
World
event,
Physiotherapy Day.
Exactly, across the globe.
Yes.
But let's narrow down to our context in Kenya. What are some of those gains made so far?
Well, a lot. For a long time, Doreen, this country had only one training institute for physiotherapy. Only one. And that was Kenya Medical Training College, an institution that we respect because has really bridged the gap in terms of producing competent health workforce to meet the rising needs of our public health across Kenya. And some has even gone beyond our boundaries. The gains we've made is that now you don't have to queue and go to Kenya Medical Training College, Nairobi.
For training.
To get training. KMTs itself have devolved other campuses. They have like now 5 campuses that offer physiotherapy. Again, that increases the intake for persons willing to be physiotherapists. Leave it there. That is at diploma level. KMTC has gone ahead to offer specialization courses, whereby we cannot say one tool fit all. You go to the area of interest and get trained and become a specialist. So right now as we speak, we have people who have specialized in orthopedic manual therapy. These are issues to do with the muscles, bones, ligaments, tendons. These are people who can work very well in sports industry. These are people who can work very well in an institution like this, whereby sometimes sitting is the day, and that can bring stress to your joint. We have our other professionals who are moving with the camera. It involves maybe bending, lifting, standing for long. That is musculoskeletal. Another interesting part is now what we call now the pelvic health. And you know, in Kenya or in Africa, it's been a taboo to talk about the pelvic health or to talk about the reproductive system of a human being. Yet, we have a population as young as 35 males who are having erectile dysfunction disorders. What do? They sneak, go see the physician, they get these drugs to boost their sexual life, when it's something that a physiotherapist trained in pelvic health can help improve that muscle to perform. Our female, our sisters, young as 30, maybe due to factors that are beyond their control. It could be forced marriage at early age, affecting their reproductive system. It could be rape. It could be child labor. They end up with incontinence or urine leakage. They go to work, they have to carry like 3 extra panties so that they change. They suffer in silence. Today we have physiotherapists trained to improve improve the performance and the life of this kind of individuals. But we leave KMTC alone. When you finished KMTC those days and you want to upgrade to bachelor's, master's, the nearest school you'll get was in South Africa.
Not even in Kenya.
Not even in Kenya. Today, we have universities that offer bachelor's degree, that offers master's. We have JKUAT, we have AMREF, we have Moi University, and many other. So that is in terms of training.
Yes.
In terms of practice, again, we've seen increased uptake of employment for physiotherapists, structured employment. And this you can compare because physiotherapy we are like a family of what we call rehabilitation medicine, where we have physiotherapy and other sub-cadres, not sub-cadres, but other important cadres like occupational therapy, speech, and so forth. But if you walk into a healthcare institution, if you walk to Kenyatta National Hospital, or you walk to Karen Hospital, the number of physiotherapists versus the number of occupational therapists, you'll find more physiotherapists available in the institution. And I mean, it goes with the numbers. I mean, you'll only employ where there's need.
Yeah.
Okay? The resources are scarce, and not only they're scarce, they have alternative use. So as a physiotherapy profession, again, that's growth that we've witnessed, increased uptake of employment compared to like 20 years ago. Still, of course, there's a lot we need to do about that. In terms of regulations, again, not even 20 years ago, 10 years ago, it was, I think I'll say it was almost very easy for Doreen to wake up, offer that massage you're talking about, and say it's physiotherapy. Because we didn't have an oversight body that is anchored on the Kenyan law. As we speak, we have an oversight body, the Physiotherapy Council of Kenya, that has provisions on who is a physiotherapist and what should a physiotherapist do.
So not anyone who thinks that they can massage as it were, or as it was termed, then they regard themselves as a physiotherapist.
And I need to make this clear.
Yes.
Any patient who has to seek physiotherapy services, if that is a physiotherapist, let them produce for you a license. It is in the
regulations have gone as far.
Yes. Our license is like an ID form or a driver license.
Which is what you're showing, actually.
So you can carry this. Any physiotherapist with a license should supposed to have this when they practice. Any patient, let that physiotherapist show you their license.
Well said. So that is in terms of training, in terms of regulations.
In terms of practice.
Yes, in respect to some of the gains made.
And lastly,
yeah.
Like those days when we started school, the books, the research we used to read, because you have to be, like if they want to train, they want to give you, to train you like this cup can be used for treatment. They'll say a study was done, maybe they were treating rats and so forth, and this was the result, the efficacy, the efficiency, and so forth. Those studies that we were reading, nearly all of them, nearly 99%, were studies that were done outside Africa. Today, as we speak, we have studies done in Kenya, meaning we have physiotherapists who have gone to the level of now publishing their own research. And so again, implementation becomes easy because it is done on our population. The recommendation is based on our population, as opposed to a study done in Italy, and they want to copy-paste the population in Italy and implement in Kenya. It becomes a challenge.
It becomes a very big challenge. Before we get to the undoing of some of these gains and perhaps why it's not held with high regard that it needs to, just listening to the gains you've enumerated, quite a number of them. But there's something you mentioned on the practice that, and your example was that if you walk to Karen Hospital, for example, you'll find the occupational therapist, therapist with the more compared to the physiotherapist. So then does this mean that there's a difference between these two?
Well, yes, of course. There's a big difference between occupational therapy and speech therapy and physiotherapy.
These are the types.
No.
They're not the types.
These are how do I make it easy for you? You see, like when you're building a house, there's that person who is in charge of the structural component part of it, isn't it? How the walls are coming up, the lintels and so forth. Then you'll get someone who is now in charge of roofing. Then you'll get someone in charge of lightning, wiring. Then you'll get someone in charge of interior design and so forth. Okay?
Yeah.
At the end of the day, they're giving you a house.
But each one with their own roles.
Each one with their own roles, and scope of practice. So you cannot say that since I've done a very good foundation, I don't need you don't need to lecture me about the roofing. No. Okay? So they are not like subspecialty for physiotherapy, but they are sister professional colleagues. Okay? We don't do the same job. We have a clear cut, and even the regulations, they have got different regulations. But in the umbrella, it's just like there you want to bring, you want to put, you go to theater, and you'll find an anesthetist working very closely with an orthopedic surgeon. Doesn't mean they are regulated by the same person. They study the same, they specialize in the same thing, but they work together. They work in the same premise, the same system, working together. So they work in tandem. Exactly. For the benefit of the patient. Yeah. And this is a good point to actually go for that break. When we come back, we explore more of those loopholes as well as the event that also will be happening tomorrow. Thank you. Time for that breather. When we come back, we still explore more of matters to do with physiotherapy, also in relation to it being commemorated tomorrow. Stay put. Welcome back, and still holding court with my guest Henry Opondo, who is the president, Kenya Society of Physiotherapies. And we're still talking about matters to do with physiotherapy in relation to tomorrow's event. Before we went on that break, Henry, we were talking about some of those gains, and clearly, just as I had put earlier, there's really a lot that has been made in terms of gains. But as you're saying earlier, when you look at this profession, there's still not being held with the high regard that it needs to. In fact, even just understanding that at the end of the day, it's a medical profession, not just any kind of, theatrics that you might want to put in relation to massaging a patient based on whatever they're suffering from. But let's look at those loopholes and the undoings therein. And when you're talking about the gains, you mentioned that back in the day, KMTC was the only, training institution. Was that perhaps one of those undoings of this kind of profession not being recognized as it needs to?
Thank you, Doreen. I wouldn't say that that largely contributed to it, but partially maybe yes, because for example, out of good faith, Kenya Power, it's the only producer of electricity, and so we have to abide with whatever we have, and again, we don't know the alternative. Okay, so by just
people having alternatives of solar energy.
Yeah, but that will not be. It's also come with a lot of installation, a lot of security checks.
Sure, I get your point. I do.
You get it.
Yes,
you can put it, and you're not sure if it's going to stay forever.
Yeah.
A lot of it, but electricity, once you install it, I mean, it's hard. It's hard for someone to come and remove the wires and so forth. So maybe that monotony created space, because you realize there are many needs. There are people who need these services, but the supply is very limited. So people crossed borders, and they did certain courses, and come back and pose like physiotherapist. And as you say, there's been a thin line, but it's because we also as physiotherapists we've not been able to come out clearly and tell the public, tell our colleagues what we do, and show them what we do, and document what we do. So it's also our own undoings as physiotherapists.
So it goes both ways.
It goes both ways. And then the third part, the undoing, which is still again monopoly, you find that there's the essential commodities and supplies, machines, equipment, and so forth. You find that centrally they are still being approved by certain institutions that we really respect, and these institutions really, they are not physiotherapists. They don't have physiotherapists in their midst to advise them that ideally this is safe, this is not safe, and that's why you get to see patients who are capable of buying certain equipment, they buy and they want to use it to treat their back pain or their leg pain, and they end up with first-degree burn, second-degree burn. It's because
they become their own untrained physiotherapists.
Exactly, because, I mean, physiotherapist was not involved in assessing the authenticity of this product, how safe it is, and that's why you get Serajem wants to associate with physiotherapy because they know physiotherapy is a medical term, it's a medical profession, but let's see how we can sneak this and say it's treat stroke within 1 day. So those are some of the undoings that we've witnessed by having limited scope of trainings, limited scope of regulations.
But now, based on what you said in terms of training and regulation, at least we can say that we are moving forward towards the right direction.
Trainings, we are moving right in the, we are moving correct in the right direction. In regulations, I think we need to really up our game. And for your information, I'm also chairing the Physiotherapy Council of Kenya. And we just have our inaugural meeting yesterday, trying to structure and really make sure that we try as much as possible to make sure that the environment is safe. I mean, the people posing as physiotherapists are true physiotherapists. One of the areas highly abused are sports.
Okay. These are the sports?
Our sports personalities in Kenya. If you do an audit and find the people moving with them as physiotherapists, I think those are the people that offer massage that you are talking about. Yes. So we still have some work to do in terms of oversight, in terms of regulation, but in terms of practice, we're in the right direction.
In the right direction. Now, before I come to the roles, because I want to get there and also the tech bit of it and the innovations therein, let's just stick on that regulations bit for a moment, because again, you've equally mentioned our sports personalities, and this is a conversation that is always out there when it comes to our sports personalities and them being misused. Yes, they represent us in a very good way, but the underlying factors really oftentimes come out a lot. So, I mean, in this regulations, but then what more do we need to do to just streamline that area?
Thank you, Doreen. In health system management, we call it leadership and governance, stewardship. I think we as leaders from different sectors, Ministry of Health, Ministry of Sports and Labor, I mean, let's have the goodwill. Let's have the goodwill and listen to each other in terms of recommendations that we make. Physiotherapy, as I told you, is a medical profession.
Yes.
And when we communicate, which we've done, I mean, we don't need to really do other things that are not necessary to make you understand that our sports personality in their team, besides many other cadres that are needed, like nutritionists and so forth, for physiotherapists, let's use the existing structures to ascertain or to assess that yes, so and so is a certified physiotherapist with special interest or with speciality in sports. Why would I give them, for example, if he's a physiotherapist who has special interest in pediatrics in Gertrude Children's Hospital? So to me, it's more of governance issues, because we have people with skills, but to penetrate there is the problem, and that's why I'm talking leadership and governance. We have enough human resource. We have people who have been trained. We have ways to evaluate that truly you are a recognized physiotherapist and you can do it, go do it. So the issue that we are trying to say today, and we will be saying tomorrow,
yes,
is the contribution of physiotherapy in the life of our public health.
Okay, so then does this mean that a physiotherapist is not just a physiotherapist? There's expertise and speciality depending on a particular field?
Where we are heading to, the last 5 years, we have specialities in our midst. It is time to recognize the specialities if we mean professional growth.
Mm-hmm. I still want you to explain it further. I hear you saying that in the past 5 years, that's where we are going. But then, because when you talk about physiotherapists, so to speak, and just as we have talked about for the past few minutes in this conversation, there's always that assumption, and that's what I want us to really break today in this conversation. So then, when you talk about physiotherapist for this particular patient or this particular disease or this particular area, it means then that when you talk about this person is a physiotherapist, then there's a form of speciality and skill they have in this area, but they're still a physiotherapist. Then there's one who has a skill in a certain area, but they're still a physiotherapist.
Perfect. So I think I get your question very clear, and let's try to make it very simple for the public.
Yes.
A doctor graduates today from University of Nairobi. He's called a medical officer. Okay?
Yeah.
He's called a medical officer. He goes and works, for example, in the casualty, or what we call accident and emergency. Mm-hmm. He will see all the patients, okay? But there are those cases that he'll want to refer or consult. Maybe a physician for infectious disease, maybe an orthopedic surgeon, maybe an ENT. And there are those who are like, yes, I can manage up to this level. However, you need now follow up with a specialty. Now, we have physiotherapists, both diploma and bachelors, trained. Okay? They come up as, in quote, medical officers. These are now the physiotherapists. But we also have physiotherapists that they have moved from medical officers, that is the graduate physiotherapists, whether diploma or bachelors, and have now specialized. Just the same way this medical officer will one day go back to specialize and become a gynecologist, a pediatrician, neurologist, orthopedic surgeon. The same with physiotherapists. Yeah. After their basic training, and basic training could be diploma, could be the bachelor's, then they go and now specialize in these trainings. So what we are saying, we have a large pool of acute setting or hospitalized patients which need physiotherapy. But out of that population of the acute setting or controlled setting, maybe you have 1,000 patients. You may get 10 that has got special needs that you need to consult, including myself. I meet patients who has neurological issues, and I feel like, you know what? I am not a specialist in neuro. I need to consult Dr. Catherine Wambua, for example, who is a physiotherapist.
In that area.
In that area.
But that's but you're still a physiotherapist, not just specialized in that particular area. Okay.
And there's still the much I can give this patient. But in terms of, you remember I talked about in defining physiotherapy.
Yes.
We want to restore, we want to maintain, and we want to optimize. You know, optimize is giving the best that you can achieve. Patient mobility, patient function, and well-being. So maybe, to make it simple, at the point of optimizing their mobility, their function, their well-being, is now I need that specialist.
Well, that's why it was important for me to ask, that question just for clarity and also for viewers to understand that we have a physiotherapy is a physiotherapy at the end of the day, but each of them is skilled in a particular area. Because, you'd have someone, perhaps a cancer patient, you have an older person, children. they will all be taken care of by a physiotherapist, but depending on the skill is what will determine who will take care of a cancer patient, someone with a wound, an older person, children, there as you go like that.
Perfect.
Okay, now that makes sense.
Makes sense. Makes sense. As we speak, and it's like you read us very well. We have physiotherapists who has got special, how do I call it, skills in managing patients in those very, very tight settings like cancer, lymphedema, whereby you get, because of the cancer, the lymph nodes are blocked, so you get the limbs swell beyond control. Yeah. Yes.
And that needs a skilled person to do that. You mentioned, mobility, function, well-being. Are those the roles of a physiotherapist, or they go beyond that?
So, mobility is movement.
Yes.
Okay? Movement, walking, sitting, and so forth. Function. For you to function, so mobility, we are looking at the body. Mobility. What could be challenging? What could be minimizing you? We call it in medical term impairment. The cause of the problem, not the problem. Okay? The problem could be back pain. Okay? So back pain could be preventing you from sitting long. You get that?
Yes.
So we are looking at the impairment. What is causing the back pain? And that is a big topic. Just mobility. That is a big, big topic, because there are thousands of information on your spine that can cause back pain. And for you to get to the point of reasoning that there are 1,000 things that can cause back pain, first of all, you need to understand what is the back. What is the orientation of the muscles? What is the orientation of the vertebral bodies? What you call the spinal cord, but it's not actually spinal, but the vertebral bodies. What is the orientation of the nerves? And then now come and make it, dissect it, and now say, okay, if you sit, this is what is happening. Now we are trying to add what you do experience, what we have physically assessed, to make a judgment that, you know what, it is your discs. Or it's actually the facet joint. That is just mobility. So we fix mobility.
All this was just mobility.
That is just mobility. Let's go to function. So you function while sitting? Yes. My nature of work require me to sit. Okay? Okay. Maybe I'm a long distance truck driver. Take a truck from Mombasa to Rwanda. That is sitting. That is how you earn your livelihood. So we have fixed mobility that now you can sit. But now comes the question, for how long can you sit? Can you continue with this activity of your daily life? Because that is our aim, to promote that functionality. We don't want to tell you stop working, because that one we are making you disabled. Okay?
Yes.
We want you to continue working. So how do we sustain the gains we have made? Now that is function. And again, that is a whole topic
by itself
of physiotherapy. Talking about strengthening exercise, talking about endurance exercise. And again, you must understand which muscle are you working on, because it is these muscles that provide natural support to your spine. You'll see many people rushing to the corset, those belts they buy and put it. I call them artificial support, when God had a reason why he gave you the natural support to function with it. That's why physiotherapy is coming in.
But the corsets also come in with different reasons.
Yes, they come for different reasons.
People put it.
But doesn't mean they should be part of your life. The problem becomes when it becomes part of your life.
Okay.
If you tell me you want to drive from Mombasa to Rwanda on a corset, the opposite is that you're disabled. And the physiotherapy try to bridge that gap, that you can function. You remember function?
Yes.
And make it more functionable within your setup, your age, nature of work, and so forth.
Regardless.
Yes.
Then there was well-being.
The general well-being. We call it health and fitness.
And let me just get it before you go there. So these are roles of a physiotherapy.
These are primary functions of a physiotherapy under the context of clinical service delivery or clinical intervention.
All right.
We are clinicians.
By profession. Well-being, what does this entail as you're explaining, the functions and the mobility? What about well-being?
Yes. So well-being, let's look at it broadly. Let's look at it broadly, okay? Well-being, like you are well. Well-being, okay? So we are looking at health and fitness. We are looking at, and this is one of the primary roles, that why do we have to wait until Doreen has low back pain to seek healthcare services? If you look at it economically, and that's why in developed countries, they try to minimize patient admissions. They try holding patients within the setup because that is loss of labor. The longer you stay in bed, the more unproductive you are to the nation. Okay?
The worse it becomes to the economy.
Exactly. And that's the bigger picture.
Yeah.
Now, the people who depend on you, the people who need bread, the people who need to be told bye in the morning going to school. That is part of well-being. So we are trying to make an effort to promote what we call health and fitness. Ergonomics. Working while still maintaining a proper life. Because it has been proven that when your back hurts, it bothers your mind. When it bothers your mind, it challenges the stability of the mental judgment. When the mental judgment is destabilized, you become emotional. You try to minimize social interactions. Me, I can't squat. Me, I can't dance. Me, I can't go do that. So we're looking at how can we promote physical wellness to provide overall well-being, preventive health care. That's what I'm saying.
Well said. Now, let's look at the trends and innovations in this particular practice. I mean, Henry, we are living at a time whereby it is the innovations. We're looking at social trends, so to speak. We are looking at innovations in different capacities and different fields. When it comes to physiotherapy, what are the trends embraced or therein in this practice?
Yes. We are
some terms that I also want us to look at very briefly, but what are those trends first?
Well, a lot is going on, and we are catching up. So let's look at, first of all, on the training side. You find that, for example, the institution I told you, like KMTC, that is offering specialization courses at higher diploma level. We have also like AMREF that is now offering bachelor's degree. The innovations that they have managed to bring into practice or into use that is really benefiting our physiotherapists is what we call the e-learning, the online learning platform. And you find like the two institutions, most of the faculties that they have are not within the country. They're abroad. And so we're actually having remote training, but so to call it best available teachers. We can as well say our own candidates are studying in UK.
Much as they are here.
When they're studying, not even studying in school here physically, at their home.
Oh, that's interesting. So those are some of the things that have been embraced when it comes to the aspect of training. All right. There's something that I also came across, electrotherapy. And I want to believe that this is a term that is used when it comes to physiotherapy. Perhaps you can tell us, what is this? Maybe what has it been, and at what point is it used?
Yeah. Electrotherapy is a widely used term in physiotherapy. And it's also a term that has been highly abused.
How so?
Yeah. Electrotherapy, therapy, let's divide it. Therapy means treatment. Therapy means treatment. You've heard of chemotherapy?
Yes.
It means treatment with chemicals. Okay? Physiotherapy, treatment with physical means. Radiotherapy, treatment using radioactive waves. So therapy means treatment. So when you talk of electrotherapy, it's therapy based on electronic. Not electricity.
This is class 101.
It's treatment based on electrophysical agents. It's based on machines.
Yeah.
That's what we're talking about. And we have a number of machines. We have what we call ultrasound machine in physiotherapy, leave alone the ultrasound in imaging. You know that ultrasound they do when they want to see how the baby is growing?
Yeah.
That is for imaging. We also have ultrasound in
And just to butt in, that's in respect to the innovations.
No, that has been there. The only thing...
It has been there?
It's been there. The only thing is that...
Why does it look like a new term?
The only thing is that there's been a lot of improvement in terms of the products.
Okay.
Just like in 1990s, the best car was Peugeot 544. And if you had it, it means you had money. Today... You
can't quite have it.
Yeah. So they have been there. They have been there. The only thing, there's been a lot of innovation. We are really getting highly state-of-the-art equipment and so forth. So we have we have TENS, what we call electronic nerve stimulator. We have laser therapy and so forth. But these machines, to make our people understand, is that these machines also, they have a limited scope. They have a limited scope. To me, these machines are like, they are part of our strategy of offering treatment. Okay?
Yeah.
If I'm a surgeon, I can decide and say, you know, take Neurobin, take some nerve drugs, anti-inflammatory and painkiller for a month, and let's see. Then second month, they say, you know what, take these painkillers and do physiotherapy. Then the third month, they say, no, now let's go for surgery. Okay? So it's also in physiotherapy. We have different phases of treatment. So electrotherapy, we tend to use it a lot in acute phase. Acute phase is whereby the patient is highly inflammable. The patient is in so much pain, so much pain, acute trauma, like fresh injuries, whereby movement produces, or movement adds them more pain.
All right.
Okay. So we use this to make it very easy. We use it to numb the pain, so that we can offer some exercises, so that we can offer some mobilization, we can offer some training, we can offer some kind of posture correction.
All right, well said. And I can already hear my director, just saying that you're pinched for time. But I wouldn't want us to exit this stage without talking about tomorrow's event that you're having in collaboration with KNH and KMTC. Talk to us a bit about that in 2 minutes?
Yes. The Kenya Society of Physiotherapy, which is a registered entity under the Registrar of Society, whose primary mandate is to promote good practice of physiotherapy, not only taking care of our physiotherapists, but taking care of the consumer of the services, which is the patient, and other stakeholders that are involved, like the payers, the insurance companies, among others, has organized 8th September. That we are going to commemorate the World Physiotherapy Day. We are doing this, number one, because we are a fully affiliated member of the World Governing Body. It only happens for people who are affiliated members. Okay? So what we are doing tomorrow, we are inviting the public. whether you are sick or not sick, come for free screening of anything to do with muscles, tendons, joints, ligament at Kenyatta National Hospital at the parking lot. We have combined, we are actually having more than the two that you mentioned. We have Nairobi Hospital coming, we have Karen Hospital coming, we have other hospitals coming. We're expecting over 200 physiotherapists. So we welcome patients for a free screening. The event will be flagged off by the CEO, Kenyatta National Hospital. The walk, we shall have a walk, 7-kilometer walk with it's called what? Don Bosco Boys Band. So we shall be marching, which is part of exercise.
From what time?
From 8 a.m. Let's all assemble in Kenyatta. The walk will be flagged off at 9 a.m. by the CEO Kenyatta, and the day we shall finish the day in KMTC auditorium with a keynote speech from the CEO of KMTC, Dr. Kelly.
All right. Good place to end it. Thank you so much, Henry Opondo, who is the President, Kenya Society of Physiotherapists, and he has just been here talking to us about what physiotherapy means and trying to understand all this, again, culminating it with the event happening tomorrow during the World Physiotherapists Day. Good place to also end Good Morning Kenya. I'm Doreen Arange Okello on behalf of the entire team. Asante sana, paving way for News Check coming in up next.